I have identified a really big idea, and I've established a few key insights that can help anyone who wants to get well do it more quickly and effectively. I'm Richard Nahas, and this is the New Medicine Podcast, bringing blockage based care to medicine. This is our first episode, so let me tell you who I am and what I'm here for. I'm a medical doctor who's been practicing in Canada and more recently in New York City for about 20 years. I started as an ER physician, and after 2 years of backpacking, became interested in traditional healing and integrative medicine. And after teaching, speaking, participating in research studies, and running a clinical practice, after leadership and advocacy roles, and having explored functional medicine, hormone medicine, regenerative medicine, homeopathic, Ayurvedic, chelation therapy, vitamins, herbs, detox, machines, lasers, frequencies, you name it, I have identified a really big idea. And I've established a few key insights that can help anyone who wants to get well do it more quickly and effectively. So let's start with blockage based care. What is this and why does it matter? So let's declare a blockage hypothesis of disease. There's not enough evidence to call it a theory like the germ theory, but the blockage hypothesis may be just as important. What it states, quite basically, is four simple things. One, that our injuries can create permanent scars in the nervous system and fascial network. Number two, that these scars can act as sources of electrical noise, disturbing the balance in the regulatory system as a whole and affecting how the immune system, the endocrine system, and even your thoughts and emotions manifest because of these points of stress creating inflammation, tension, and acting as what the Germans call disturbance fields. The third principle is that these lesions can be identified and treated in clinical practice, and that whether you use a local anesthetic to inject them, or use your hands, or an acupuncture needle, or a laser device, targeting these lesions can stimulate a healing response from the body. And number four, perhaps the most important, these lesions are palpable. And that means that any person can learn to find and release the hot spots in their physiology, the tension points in their anatomy. And this allows you to target your scars for self-care, and it allows your providers to target your scars for more effective, personalized, targeted treatment. So if the blockage hypothesis is correct, then treating blockages represents a historic medical advance. This is why I'm here, at your service and the service of all our brothers and sisters to come. Whether you're a medical doctor or a rehabilitation provider or a wellness practitioner, whether you're a person with an illness who's trying to get well or a person who's doing fine and trying to get better, learning about blockages can change your wellness journey. So click the buttons, like and subscribe, share it with your friends. Here you'll get a unique voice and a unique lens that will allow you to navigate the thousands of options you have when you're trying to get healthy. The second big idea that I'm bringing to you here in this podcast is a concept called rational prescribing. What does that mean? It means that if you've got a condition that you want to improve and you want to explore how holistic options can help you, you should try one thing at a time and try to measure where you're at the start and at the end of each trial to identify the things that work for you and build your personal self-care and wellness regimen one trial at a time. So, as the president of the North American Academy for Neural Therapy, I am required to tell you that this perspective is not new. Therapy that comes from Germany called neural therapy was developed nearly a century ago. A doctor and a dentist, two brothers named Walter and Ferdinand Hunecke, first described these lesions they called Störfeld, interference fields. They taught lectures and workshops. They published papers. Their students traveled across Europe and to Latin America. And today there are thousands of doctors in dozens of countries who treat interference fields with injections of local anesthetics. They call this neural therapy, and it's completely unknown in the English-speaking world, but I'm here to change that. So if you have a chronic health problem and you think that you need a new perspective, stay tuned and learn about how blockages are a paradigm shift in healthcare.